Which slide us into
Call this meeting to order. Attendance, please.
Anne,
here.
Artist,
Here.
Don,
Here.
Mike,
Here.
Pam, here, Rod,
Present.
and Toby.
All right, you guys enjoy this and pledge allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. I have a motion for approval of the agenda. Second. Motion's been made and seconded by Rod to approve the agenda. All in favor, signify by saying aye.
Aye.
Motion is approved. Citizen comment. Anyone wish to address us for something not on the agenda? Looks like we're all part of a happy family. All right. We will move on to approval of the minutes.
I move to approve the minutes as presented.
Second by Dr. Baharski. All in favor, signify by saying aye.
Aye.
Minutes are approved. We'll move right into the supplemental reports. We'll start with community health.
Good afternoon, Board of Health. I'm Mackenzie Gress. I'm the supervisor for community health. Before I give updates for community health, I want to introduce you to our new staff member, Haley. Haley joined us about a month ago. She's working the front desk in the immunization clinic currently, and we're going to cross-train her to help in WIC also. I wanted to give her just a moment to introduce herself and tell you a little bit about her background and what she's looking at for schooling.
So I'm Haley and I'm a public health major. And so I'm in my undergrad program right now. I have 2 years left and just getting some experience in public health before finishing my degree.
Yeah. Thank you.
I don't really have any significant updates in the immunization clinic, kind of just status quo, moving along. Our numbers look really similar to what we would expect. In our asthma program, you might be, I think it's on like the next slide for numbers, but you can see that caseload did increase 20% from last month. Our asthma nurse had to exit several clients a couple months ago and has been working diligently to get referrals and outreach. One thing that's been really interesting with our new referrals that have helped increase her caseload, she is able to provide both remote and in-person visits. She's the only asthma nurse for the Northwest region. So several of those new clients that have been added to her caseload are all out of Browning, which I think has been really cool that she's been able to serve someone that doesn't naturally have an asthma nurse. In the WIC program, WIC visits were slightly up this month. That looks in part to be because of the increased WIC Smarts visits. You can see compared to last month at 23 visits and last April at 30, we had 50 this month. So increase those numbers a little bit. Just means that we were able to see more clients issue more benefits. The WIC team is completing their training on their new documentation software. So that will roll out May 21st. I wouldn't be surprised if we see a small dip in numbers just as that's rolling out. We've built in a little longer visit times than typical to allow for our staff to be able to chart in that new system. WIC is also preparing for the farmers market program. They'll be able to start offering those benefits in mid-June, which is earlier than typical. So people will have longer to access those farmers market benefits. In home visiting, Karen Weaver was our lead home visitor. She had her last day with us at the beginning of May, and she has taken a new position at Logan Health to do care coordination there. She has been a fantastic role for us at the health department serving families, and we're excited to now have her referring families to our program out of the hospital. We think that'll be a good partnership. We are not going to rehire her lead position, but we are going to fill that vacancy with another home visiting position. So that will be a 0.8 FTE. We've been doing interviews for that and anticipate filling that very shortly. Last month for home visiting, we received 10 referrals from 7 agencies and had 4 new enrollments. Because we are down that home visiting position at the moment, we are seeing a small wait list, but I anticipate that that will resolve as soon as we onboard our new person. Does anyone have any community health questions?
Seeing none, thank you.
One quick question.
Oh, I'm
before-
sorry, Rod.
It's actually for Haley. Where are you doing your undergraduate studies?
I'm studying at Boise State, but online.
Perfect, thanks. Just curious.
Yeah.
Thank you.
Sorry, Rod.
Quite all right, thanks.
All right. Next, we'll do population health.
Hi, everyone. I'm Malia Freeman, and I'm the Population Health Supervisor. So on the communicable disease side of things, we did not see any significant outliers in our case reporting in April, which is good. As we're moving closer to summer, we're also trending out of respiratory illness season, which is reflected in our respiratory illness cases. Those are also trending downward in April and will probably continue on in May. And then we also did not see any significant outliers in any of our reported outbreaks in facilities in the past month. And most of those outbreaks were in childcare or daycare settings. Any questions on communicable disease? Okay, so on the chronic disease side of things, our Montana Cancer Screening Program actually recently got to partner with Greater Valley Health Center and Logan Health. And they hosted a mobile mammography event up in Hungry Horse on May 9th. The event was really successful. We actually had 17 women screened that day, and that's the highest number we've ever had at the Hungry Horse event, which was really great. We had a few women who said that they hadn't had a mammogram in over 10 years, and we actually had one patient who hadn't had a mammogram in over 20 years. So it was really a good opportunity for our staff to be out in the community and really connect women with those needed cancer screenings. And our cancer screening program is doing really well this year. We're actually really close to meeting our annual goal, and we haven't been able to do that in a while. So we're getting really close and really working towards kind of promoting and supporting that program in the next couple months. Does anyone have any questions? Thank you.
Thank you. Family planning.
Good afternoon, Board of Health. Mandy Fleming, Manager for Family Planning. So the month of April, we did see an uptick in patients compared to March. So back to normal with our patient load, which is a good sign. April also marked the beginning of Family Planning's grant year. So we have a new goal for unduplicated visits. We raised our goal by 2%. So we're trying to see 2% more unduplicated visits than we did last fiscal year. Also with family planning, yesterday, we partnered with the immunization clinic they did a back to school immunization clinic, walk-in clinic, and our providers did sports physicals. So we're trying to find a way to we have 2 nurse practitioners, and we're trying to find a way to use them in different ways at the top of their scope and figure out different ways we can use them in the community to meet a community need. So we did $20 sports physicals. If a family couldn't afford the $20, then we waived the fee. And we're going to be doing another one this Thursday. And if those are successful, I think we're going to continue to do them throughout the summer and at the beginning of the school year. So just a new service that we can provide our community. Harm reduction programs stayed about the same. Visits are pretty even, and our exchange rate seems to be staying pretty even as well. Any questions?
Seeing none.
All right, thank you.
Thank you. Welcome. You?
We're doing these notes.
I am Jim Wardensky, with Environmental Health, and, you can see our numbers are coming up a little bit. It's that time of the year where things, really start hopping for us. The seasonal stuff, like Under the Big Sky, Scout and Gather, Food Truck Festival, farmers markets, all of those things are, underway. The planning for some of those larger events, we've been attending meetings and working with organizers to get that all squared away and to ensure public health. And then, a couple other things. We're continuing with our hiring process for the front office position. we interviewed a young lady Tuesday, I guess, and we're hopeful, to see how that goes. We're in the background investigation, reference checks, step right now, so hopefully we'll have an answer on that. We do have a few other applicants, that we're sorting through, so hopefully we get to fill that position here fairly quickly, so. Air quality stuff, one thing that I wanted to mention regarding that is, as of the last 2 days, we were communicating with the NRC and the Forest Service and, local fire districts. They had some concerns about high wind over the next few days. And it was really satisfying to see how that level of communication is going on between the fire folks and the air quality folks, and making sure that we can communicate and come to a consensus quickly to be able to turn on or off the ability to burn. Of course, from an air quality standpoint, a lot of wind is good because it moves out all the smoke. From the fire standpoint, not so good. So, they decided that the next couple of days we won't be able to have open burning, but I was just happy and wanted to mention how that process is working and seems to be working well, so. We've had a few food recalls here over the last month, and just so you guys know, when we get those, if we're alerted, however we're alerted, frequently it comes from the state, from DPHHS. But our folks are really good at kind of perusing things, the internet, social media, and if they're seeing things pop up before the state alerts us to it, then we inquire about it and make sure that that's posted on our website. We reach out to, if it's distributed anywhere locally in our area, we reach out to those vendors and make sure that they're aware of it so they can pull the product or do whatever they need to do to mitigate those recalls, so. And in the past, one of the things that we've utilized, we have a call them all, text them all capability where we can reach out to mass numbers of facilities just with a simple text. We get a report back almost instantaneously. If those texts didn't go through, then we try and call those locations or physically go out to them to make sure that we have a high level of notification there, so. I wanted to mention too that we've been receiving a bunch of different types of complaints as far as septic complaints, food and consumer complaints, air quality complaints. And just to give an idea, earlier this week, as I was completing one of the reports on a complaint, right now we have 535 active septic complaints. And by and large, Devin Fetter in our office, she's an environmental health technician. She's the one that deals with those. So, I try and pitch in where I can. They're in various stages of investigation and notification and turned over to the county attorney's office and all that. But I guess you can look at it two ways. One is that's a ton of complaints to deal with. But then if you think about it from the standpoint that we have over 40,000 septic permits in Flathead County, 535 complaints, some of which aren't viable complaints, really isn't a ton. So I just mention it because, as we navigate those complaints, they take a tremendous amount of work. You have to go out and inspect things, try and get pictures, talk to witnesses, document things, communicate with all the parties involved, so it can really be time consuming, so.
Yeah, and.
So could you give us an example of what a complaint might be?
Yeah, that's it.
Sure. So from a septic complaint standpoint, one of the ones that I worked on this week, anonymous complaint comes to us that there's an outhouse on a piece of property. So, I Google the piece of property, see it's for sale. I'm able to look at a website that has a whole host of pictures on it, so I can look at, you know, the facilities that are there. I ended up calling the listing agent, asked that person, can you tell me, is there a outhouse on the property? And she said, well, what's the definition of an outhouse? So we went through that process, and then she said, I think you need to talk to the owner, I'll have him call you. So I waited a few days, no luck, GIS'd it, got an owner's name, found the phone number, reached out, talked with the owner, and they said, well, what we did have is we had a building, that we put a porta potty in, like a portable toilet. And, we have a vintage camper that guests stay in when they come, family and friends, and they utilize that. So we talked about that and how they can't do that. Then, as I looked at it in the real estate listing, it said that there were 2 RV cleanouts, for that property, which weren't permitted. And, so then I had to address that. And what we, concluded is that the realtor tried to, I guess, I don't know, embellish all the amenities that were there on the property. They were actually 2 cleanouts that serviced the septic line, the sewer line to the septic tank, so didn't have anything to do with RV stuff. So, you know, in that particular case, you know, they had already converted the so-called outhouse into a storage shed. And there were pictures of that on the real estate listing. So there really wasn't any violation, but it took me, you know, the better part of a day to go through all of that and then document it all and make sure that it's there. So that way, if the anonymous complainant does reach out to us, I can say, yes, you know, we took these steps. It wasn't just that, you know, we dismissed it, so each one of those, and then as you can imagine, if it's a viable complaint and it ends up going to the county attorney's office, we need all that documentation if it goes to court, so.
We have people complain about campers putting tubes out and just putting it out onto the land. I mean, there's a wide variety of complaints that we get of people just trying to live in spots that they shouldn't be living in, you know, putting raw sewage out onto the ground would be one that's happened quite a bit.
Additional living units, you know, if they remodel their shop and put an apartment in there and tap into the septic without a permit, you know, so then we have to look into those types of things. And yeah, so it is a wide spectrum of things that we look at, so.
Are there specific, like maybe 5 broad categories they tend to fall into, or is it just so diffuse that it really wouldn't help us to have knowledge of what specific, of what groups they would?
I would say that it's a wide variety, and you know, a lot of them, when they go down the rabbit hole and it's just actually just a neighbor dispute, somebody doesn't like that somebody's selling, or somebody doesn't like that neighbor, or whatever it is, and I know Commissioner Holmquist gets those calls all of the time, and then when we dig down further, they just don't like each other. I mean, it is a wide variety of things. Every day it's a new one that comes through.
Yeah. And sometimes it incorporates other entities, so, you know, the goal really is compliance. So, you know, one that comes to mind, the neighbor's complaining about another neighbor, and there are some violations there. They're working with DEQ to get some of the stuff remedied, so we're kind of at a standstill until they work through that DEQ process. And then once they do that, then we can, you know, re-engage it and hopefully get the septic system permitted, legally permitted and all that. So, yeah, a lot of moving parts with that stuff, and it takes a lot of time, and I know it can be frustrating for complainants sometimes because they want something done now. And also I should mention that sometimes there's some confusion between our office and planning and zoning. where it's a decay ordinance, things that they deal with. And, so, we work very closely with planning and zoning to try and make sure that there's that level of continuity between the offices, so things don't fall between, into the cracks, so. Yeah, so. The last thing that I'll mention is, and Janelle has the map pulled up here. And I mentioned this from a groundwater monitoring standpoint because, we were a little nervous at the beginning of the year due to the lack of precipitation that we had through the winter. And part of our regulations talks about if you have a year that is 25% below the normal precipitation level, that it could cause the groundwater monitoring results to be inaccurate. And subsequently, we have to, we can't accept them. So we've been watching this very closely and, as of April, we're at 80%. So that puts us above that 75% that we're concerned about. The things that we're seeing out in the field is that it seems to be a normal groundwater monitoring year. So we should be able to accept all of those results. So that's good news. So otherwise, what happens is, unfortunately, those people have applied, they've paid for the fees for all that stuff. And then since groundwater monitoring typically occurs between March and the end of June, they would have to wait all the way until the next spring to go through that process again. So we're happy to see this for a number of reasons. That's all I had, unless you have questions.
I do have a question. So on the open burning, I had people ask me the question, if they already have a permit and they go to activate it, how do they know if they can't burn?
They can't activate it.
Okay, so it won't allow you to activate, because I said, every time I've done it, I just went through the process and okay.
Yeah.
Nice to know.
Yeah.
Okay.
Yeah, and even at that, if they're unsure, I know some people, we deal with a wide array of folks, with varying technical capabilities. And, it'll show, at your location, if it did activate, there'd be that little,
Okay.
flame on there. If they don't have computer access or aren't, familiar with that stuff, then they can always call us and we can check and make sure that it's activated for them. Of course, that's during business hours, but, I don't know, I probably, just a guess, somewhere between 2 and 6 folks a week that I help, renew their permit that it's expired, get a new permit, or help them activate their permit. And so far, the feedback that I've gotten is they're very thankful and appreciative. So, yeah, it seems to be working well.
Thanks.
Ron?
My question is about the tattoo piercing inspections.
Yeah.
I see that there were 2 on there, and how do you determine, I mean, they're licensed. I see the 2 that you did last month were licensed, so, and the reason I bring this up is I saw a mobile tattoo trailer in the Kmart parking lot.
Yeah.
But it didn't have a name on the facility, just a phone number, and I can't, how does one know? So I guess my question to you is process. How does it work if somebody's flying under the radar on these things?
So that would come to us as a complaint, and that's one of those industries where it's pretty competitive. So if somebody is functioning without a license, and that particular facility, we got some feedback on that because, our inspectors were there and they said, initially, the appearance on the outside was that, it was pretty scary. And, they said it really did a disservice, to once they went inside, because they said it was a beautiful facility inside, clean, sanitary, everything was in order and all that. So I don't know if that's part of the persona they're trying to, utilize or.
I think I saw that one.
Yeah, but, yeah, they said.
It is licensed though.
It is licensed, yeah, so,
There's a small, did you guys get a tattoo while you were there? Was so
You can go ahead, it's I mean,
Okay.
we put the order out.
So as an example, just today, two of our sanitarians came to me and said, hey, Jim, we were alerted to the fact of a local business is performing piercings, body piercings, and they're not licensed. And, the state said that, they know it's a franchise. And, they were alerted to it in Helena, went to that location, talked with the folks, really didn't get a whole lot of resolve. So they put the word out across the state and said, hey, can anybody that has one of these businesses, can you address it? So we did, health officer's order to cease and desist piercing until they become licensed. That's only a portion of the business, so the rest of the business can function. With tattoos and body piercings, all the plan review stuff goes through the state. Our office doesn't do that. Similarly with pools and spas, they do all of that, the state does. Once they give the thumbs up, then, they can submit their application to us. We can go up and do that pre-opening inspection and get them licensed, so, yeah, so. Again, it's, that, in that particular situation, I don't know how the state was alerted to it, but they told us about it. In many occasions, it's a competitor. Sometimes it's happenstance. We had a food facility last week that one of the sanitarians was driving down the street, saw a grand opening sign and, was like, not familiar with that. She went and looked and lo and behold, it was a food establishment that was unlicensed and had been operating for several weeks. In that particular situation, again, the cease and desist order from the health officer, and they were more than happy to try and get things. There was a misunderstanding about licensing and all that. They had been working with the city on some things, and so no argument. They said, yep, whatever we need to do, we'll get it taken care of. So those things come to us in a whole host of different ways, so.
Okay. So as far as like the tattoo piercings and even the health stuff, are they just on a rotation? So
Yes.
an annual rotation when
Yes.
based on their licensing date or something?
Yeah, yeah, and sometimes depending on the type of facility, it could be more times than just once a year. Could be a couple of times. A lot of the retail food establishments are twice a year. Some of the higher risk ones are more, lower risk, less.
Okay,
So, yeah,
thank you. Nice to know you guys are on top of all this stuff.
we're trying.
Yeah.
Any other question? No? All right, thank you.
Thank you. Let's go.
Afternoon. I'm Brock, lead technician for the mosquito control program. So as you guys probably know, all the rivers are out now. Nothing out of the norm. We've got a couple of spots where they're cresting, not really flooding yet, so we're just keeping an eye on those. We're transitioning our efforts into along most of the rivers right now. So which is a chore. We're losing one of our seasonals after this next week, so it's gonna be 2.5 of us for the whole program. So if you see us running through the woods, it's because we're getting to the next spot.
You're not being chased.
So this last month we conducted 943 inspections. Treatments were 326. We covered 426 acres. New sites that were added this last month were 7, for a total number of sites of 1,643 throughout the county. While we're out dipping and doing our surveillance, we've noticed that the West Nile Culex mosquito is a little bit early this year. And we've seen that mosquito in all areas of the valley, so they're a little early this year. And lastly, Dave Nixon is getting back from DC today. He was at the Washington Day conference. And while he was there, they get to talk with the legislative staff and ask them for funding for Montana as a whole. And just to cover vector control, because there's, a lot of people don't really understand vector control or what it takes for a program to work and be integrated pest management, so. Yeah, any questions?
Do you tend to have more mosquito problems on years when there is more flooding?
Yes and no. So with flooding, the 80s, so the floodwater mosquito is more prevalent, because there's more ground being covered, saturated with water, and it hatches the eggs out. As far as hot, dry summers though, you're gonna see more culex. So basically, they are right around those kind of a pothole baking in the sun spots. And those dry seasons is when all the birds are congregating more, so you're gonna see West Nile spike those seasons, so. To start the year off, that's kind of what we were thinking, it would be more of a drier, see more culex, this season. But it's kind of early still, so.
See, no further questions.
Thanks.
Okay, so budgets, we had our budget meeting with the commissioners, wasn't too much, too many things. I do have an email for Amy about the question about the subdivision review. We're still doing them, the state's just not, approving them right now because of that lawsuit. So that might be why we went to zero, so, because we don't know when that money will start coming in again, so we budgeted that. But otherwise that, our budgets are kind of on par. Where we've been concentrating a ton of time, and I'm giving the kudos all to Keelani, is the behavioral health. So Jeremy did leave that position for the behavioral health, and then we are in the midst of applying for grant money, but then also trying to move forward with the behavioral health process. So hopefully the person that did sign the letter for the co-responder program will start July 1 is when she's supposed to, then we would have 2 co-responders. We did meet with Tammy today to kind of go over the structure of what behavioral health will look like. It's gonna be, most likely what it's gonna be is a subdivision of health admin, I guess would be the best way to call it, because we're gonna be trying to bring in more people. We have all the funding for it. We will need to have another care coordinator when we get that other co-responder on, so that we are meeting the requirements to be able to start billing, because Medicaid billing will start there. With the behavioral health, we're working with Western Montana Mental Health, Logan Health, and Many Rivers, to try to get I'm not sure what it's gonna be called, a crisis receiving center? Is that what we're calling it? 'Cause it's gonna be it's not gonna meet the.
The immediate
criteria.
solution will be the stabilization
Right.
facility.
So we're working on that. The old Glacier House is where we're looking at trying to do that. Western Montana Mental Health would be running it in conjunction, working with Many Rivers to have some staffing. It's gonna have to be staffed 24/7. Logan Health is looking at potentially security. We're not sure yet. So all of these components have to. I think we're closer than we have been, but I might have said that last year too. So we are trudging forward to try to get all of these behavioral health services really cooking, I guess would be the best way to say it in the community. We know that we know it's needed. Absolutely needed. So we are doing our best. Keelani's doing an amazing job facilitating all of these groups and keeping them on task and really asking the hard questions and kind of making everybody come to the table. Everybody's been at the table, just no one wants to eat at the table. They want to snack. We need them to have a full meal, so. So that's where we are with behavioral health. Any questions on that?
Did you say Jeremy's left?
Yeah, Jeremy, yes, and yes, he wants to farm. So it wasn't anything with us. We can call him and get any information. He's been helpful for us, but he did leave that position. He's gonna open up a coffee stand someday, cooking, making coffee. Bat season is in full swing. So we already starting to get the dog and bat interactions. I know Malia and Lisa and everybody are trying to get that information out there to people of what to do with the bat. That seems to be kind of our high after hours call volume. Just because people will interact with bats, they want to know what to do with them. It's better if we have the bat, that they haven't destroyed the bat's brain, that they haven't frozen the bat. And that we can test the bat, we can send the bat off to testing, without them. If we're able to get that bat to testing, then they don't have to have shots afterwards. So we're really trying to get that message out there, so that they don't have to go through that. So that is an absolute full swing right now. Those are my 3 Bs: budgets, behavioral health, and bats. Refrigerate it, and then bring it into, the health department, and then we, ship it off for them. So that's,
I'm just, I'm asking because I'll get the question.
Yeah.
Tupperware.
People citing containers.
Okay.
yeah,
Can we do a mason jar?
if you'd like,
Mason
but
jar, Tupperware.
we're gonna have to we have to ship it.
I'm going back. That's.
Please don't go bat hunting. Cat and dogs have been bat hunting. I think the biggest thing, and we'll reach out to the park services, and camps. We do run into it when we have tourists in town and they are staying at some cabin in Glacier National Park. And, at one point, some people that are associated with the park would say, let the bat go, preserve the bat, bats are good. And then we have 9 people from Washington that all need to, have shots because we don't have the bat to be able to test. And the bat was sleeping with them and may have been, playing with their children, that type of thing. So, it's happened. But it happened. So, we don't want to let the bat go if you've been, sleeping with a bat in your room. So we probably will get 50 to 60 bats easily that we will be testing throughout the year. So in the season, it's actually the season.
All right.
Yep.
Okay, do we have any discussion amongst the board here?
Quick question on the bats.
Yes.
You don't have to be bitten, just exposed?
So no, not just exposed. The thing is that if you are sleeping with a bat if you have fallen asleep and you are sleeping with a bat in your room, you don't know if it has bitten you. Its bite is just tiny. Its scratches are tiny. You can't see them really with the naked eye. And so the recommendation then is to have shots afterwards. Now, people can refuse. It's not like a vampire now. You don't actually. We have a picture on it. We have our picture on our website and it's just a tiny little mark that you wouldn't know, especially if somebody has been drinking inebriated and they don't know, or if there's been small children. I mean, those are the conversations that we have with the people to try to determine if they need to be, go through the shots or not.
Thank you.
I have something, I was asked by Dave Prunty of, the landfill, he's the public works director, to give a shout out to the health department because one of his employees, Steve Schaefer, had responded, to a woman while he was plowing who asked for his assistance. She said, my partner is down, so he went in the house, rendered CPR, saved the guy's life, he had an overdose, and long story short, the guy lived. Dave is very grateful to the health department. His name, Steve Schaefer, was read into the congressional record and the county received, or at least the landfill received, the large employee award
Oh, nice.
from the state. So it was all because of your staff.
Yeah, thank you. So many years ago, Joe had decided that our whole staff would be trained in CPR. That's how this all came about. And so we do have certified, I'm a CPR instructor, Malia, Lisa, Wendy, I'm probably missing one. Taylor, Johnner, Marissa, sorry, Marissa, raise your hand, Marissa. So what we do is, once we started getting all of our staff, we made the determination to offer it to all of the counties. So we volunteer our time, or not volunteer, but the health department pays for the time, and then all any other department has to do is pay for the cards. So then that kind of started with the AEDs. Dave has been a huge proponent of getting AEDs in all of the green box sites and in the trucks, because he knows his guys are out there in their trucks and driving around. So he ensures that, and so it's been a countywide thing, but it's been a great thing, I think.
Just
Safety
wanted to
first.
pass
That's awesome,
good news.
thank you. I'll have to pass that on, guys.
Yeah, no, they were very grateful.
Any further discussion?
So the budget at the commissioner's office, there were no issues other than the one you mentioned?
No.
Everything else seems.
So far.
Okay,
So far, we have our budget, workshop tomorrow.
okay.
Okay, see no further business? May I have a motion?
I'm adjourned.
And a second, all in favor?
Aye.
Aye.